Hello everyone, welcome to the Totally Well Show. I'm your host, Joyce Strong. The Totally Well Show is a place where we get curious, ask questions, and explore everything to do with health, wellness, fitness, and all the things it takes to help you live the highest quality, most fulfilling life. So today I have Catherine Collins as my guest, and she is from Healing Ways. Hi, Catherine.
Good morning, Joyce. How are you?
How are you?
Good.
Yeah, thanks for braving the slick roads today. It didn't look like much, but I know it was slippery. And here we are in Groton in the woods, as we call it. And Catherine's website is www.healingwaysconcord.com. So she's in Concord Center. Catherine is an RN and health educator and here to talk to us about her specialty. So I'm going to ask you a bunch of questions. You provided me with a few prompts, which I'll look down on, and we'll go from there.
Great.
So how long have you been in nursing?
Whoa. Probably around 35 years.
Okay.
I actually also have a background as a nurse practitioner, but I'm not practicing as a nurse practitioner now, and have a fairly eclectic background.
Yeah.
Which is I think one of the key points of my practice is that I've worked with all kinds of populations in all kinds of settings, and include health education as a main component of a lot of what I do.
I see. So we've been in nursing, also a nurse, as you know, so we've been in nursing about the same amount of time, and so I can see that you've gone through some transformations and taking your experiences to build onto what you're doing these days.
Yeah.
Yeah.
Well, I started, I don't know how much information you want, but I started off in a hospital setting like lots of RNs do, but had about 16 months, and that was it. My interest was always community health, mental health, and eventually ended up working with college students, which I loved, both as a nurse practitioner and in health education. And graduated or gradually became involved in healing work because I saw that as a wonderful adjunct to any kind of traditional medical care or nursing that was done. So one of the modalities that I use in my practice is something called therapeutic touch, which began in the nursing profession in the late 70s. I learned it in 1984. And was able to use that with many of the students that I worked with when they were stressed out or had a cold, etc. It helped them relax. They're incredibly open to that kind of work, which is therapeutic touch as a form of energy work, and just found that as again, a wonderful adjunct to the work I was doing as a nurse practitioner. It was something I could offer them to help them relax, so that healing would take place if they had a cold, a sore throat, GI problems, etc. And then when I worked full-time in health education in college, on a college campus, we would often provide relaxation sessions for students. So we'd have massage therapists come in, and I would offer therapeutic touch. And again, students were so incredibly receptive and found it very relaxing. So that's one of the things that I offer as part of my practice is therapeutic touch to anyone who might be interested.
Can you tell me a little bit more about what that would be like if I came to your office for healing, and you were first talking with me? Like, would you offer that first, or what's involved?
Okay. Usually when I see someone for the first time, I like to take a health history to learn more about not just their health issues, but what their social history is, what their interests are, how they currently take care of themselves. And depending on what the need is, I'll offer either therapeutic touch, reflexology, I'm a certified foot reflexologist, or something called integrative imagery, which is a way of working with your own images to solve an issue, to solve a problem. So some folks come because they're really stressed. And that's what both reflexology and therapeutic touch offer, is a way to just come down and feel a little bit more relaxed. Sometimes people come because they're experiencing pain. And again, both of those modalities are incredibly helpful as an adjunct to any pain medication somebody might be taking. Again, it's a way of helping to ratchet down the pain a little bit, because the first thing it does is it elicits the relaxation response. So somebody can actually relax and then allow some healing to take place.
I love that you appreciate the body's ability to heal itself. I just did a video piece, a social media piece, and that's how it kind of ends. And I heard myself saying the same thing, that yes, we need these particular medical interventions. Sometimes it is a medication or a surgery or something else that's going on, but in addition to, and sometimes even instead, we can elicit healing from the body. Can we get into each one of the specifics of those? Help me differentiate the therapeutic touch from the other reflexology, and what was the other?
Integrative imagery.
Integrative imagery. So let's start with, or go back to the therapeutic touch. What's involved with that?
Okay, so therapeutic touch is an energy modality. Again,
when you say energy, I've talked to other people that do energy, and right away I go, woo woo. So,
as so many people do.
Help me with this.
So the idea is that we all have an energy field around us, and there's a larger energy field in the world.
Yeah.
And actually, often when I meet with people, I'll have them put their hands near each other and then move them further apart so they can actually feel something between their hands, whether it's warmth or static or tingly.
Yeah.
Lots of people can feel something.
Yeah.
The idea with any form of energy work is that you help to balance the field, the energy field,
Yeah.
which is somewhere between 2 to 6 inches off our body, so that the body can heal itself. That's
So
the main
is
idea.
it electricity? What is energy?
That's a really good question, Joyce. It's part of an electromagnetic field.
Okay.
So that's probably the best way to explain it.
So this is a real thing.
It's a real thing. And actually, biofield was in 2002 recognized by the National Institute of Health, the Integrative and Complementary Care section of the Institute, the National Institutes of Health. So it's a recognized field. And there are many people that do research on the various energy modalities. I always find it difficult talking about energy, because people who ask questions come from lots of different backgrounds. And I guess the best way to have somebody have a better understanding of what it is to actually experience it. So with therapeutic touch differs from healing touch or from Reiki and some of the other modalities, because what the practitioner does is what's called an initial assessment. So what I'll do is move my hands, and I won't do it over you, from head down to your toes, looking for any imbalance.
And you do, like, not touching me, but near me. Okay.
Near you.
Okay.
And that's, people often get confused about the term therapeutic touch. It's a virtual touch, actually.
Okay, so you're never actually touching me.
I do
Yeah.
often, if I have permission from the person to do that.
But you don't have to.
You don't have to. And I will say, with any of these modalities, I always get permission from someone before offering them. And I ask each and every time they come in. I can touch because I'm a nurse, and it's under the Nurse Practice Act in Massachusetts that allows me to do that. If someone trained in therapeutic touch is not a nurse, they can't touch.
Oh, that's interesting.
Yeah.
Yeah.
So some people like the actual touch, others not. And some people have told me they prefer therapeutic touch to massage because they don't like to be touched. So they find it very relaxing. So what I initially do is what's called an assessment, looking for any signs of imbalance. And then, and I know it sounds woo-woo, I wave my hands, what's called initially clearing, so helping to just move energy around, and then either directing energy or just holding my hands around somebody's body to allow them to take in what they need. I'm not giving my energy, I'm not taking somebody else's energy. It's the universal field. Which I know sounds wacky, but that's what it is. I'm a conduit.
And I don't think it sounds wacky, but it's hard for me to imagine because I can't see it. Because I have this picture of electromagnetic, and I know that's real.
Yep.
And I have that in-body device that runs a current through you, and I can tell you what your body fat percentage is, and that's real.
Yep.
And you maybe will feel some tingling, but you don't usually feel anything. So how can we get this very accurate data if it's not real? So I believe it. I just have a hard time picturing you as the conduit, but that's where I have to look at the result at the end and say, well, if it's working, something happened. So
exactly.
And I like that you make the attempt to explain it in a more scientific way for me, because that's where I come from.
Yes, and as I said, it can often be difficult depending on the background that a person comes from. And I have friends and colleagues who think that it's woo-woo. Which is fine.
And there are many people who don't.
Yes, exactly. And I think the biggest thing with any of these modalities is that I, as a practitioner, am not attached to the outcome, which means that I'm not trying to fix you. I'm not trying to have a specific thing happen. As you were saying before, the body is wise, and the body knows how to heal itself. And as Florence Nightingale said way back, we put the patient in a position to allow nature and the body itself to heal. And that's one of the things I like about therapeutic touch, is because that's what it does. And it's the relaxation response that gets elicited that I think many people find very helpful. That happens within the first 2 to 4 minutes. So even if somebody doesn't believe in this stuff, I've had people say, oh, yeah, I felt relaxed.
Well, oftentimes what I'll say to people is, when you feel stressed, you feel changes, right? Like they can see that the extreme. So say you get bad news and you're on the phone and your heart starts to beat really fast. You can see changes happening. So just imagine when you get other kinds of input, which is soothing or relaxing, that your body is producing those kinds of chemicals. So then people seem to say, oh yeah. And so stress can be poor for you, bad for your health, and these kinds of things can definitely help, like you say, put your body in the position to do what it knows how to do.
Well, and it's mainly because of the relaxation piece.
Right.
That allows that to happen. It decreases your cortisol levels and
just putting things in reverse.
Yes, exactly. Exactly. So you had asked about the other modalities.
So I think I understand the therapeutic touch. So it isn't necessarily touching, it might be, but hands near and you're near the person. So there's a lot of interaction, which sounds to me connection, and you being very sensitive to picking up signals from people.
Exactly. And the intuition plays a lot into working with somebody with therapeutic touch. So I pay attention to what my intuition is telling me. When it's time to stop, it's time to stop.
Got it.
A treatment ends anywhere, is somewhere between 20 to 25 minutes in length, although you can help somebody with the relaxation response in less than 5 minutes, which is one of the things that colleagues who work in hospitals or in emergency rooms find really helpful, is they're able to do a quick calming over somebody, and it just helps to relax.
What a great resource.
Yeah, I think so.
Yeah. So now reflexology.
Sure, reflexology, and again, I'm certified in foot reflexology, so that's what I offer people. The idea is that there are nerve endings on the bottom of your feet, and there are various parts of your foot that correspond to organs in your body, your bones. And by pressing, you don't go deeply like someone who does acupressure would, or someone who does massage, who goes into the muscle. You're going just underneath the skin to the nerve ending. That stimulates a response. It sends a message to the central nervous system and then the brain to help that part of the body relax. If you ask me more scientifically how that works, we don't know. That's a difficult question. But again, it helps to elicit the relaxation response. I'm always surprised when somebody tells me, oh, I came in here with knee pain and it's gone. And that might last for 24 hours, which is nice. But again, I'm not looking to cure someone. I'm not looking to make a diagnosis. I'm there to support them and to offer an adjunct therapy to whatever treatment they're going through. So foot reflexology, again, can elicit the relaxation response, can be incredibly calming. For people who like touch but don't want to take off their clothes for massage, this has been a wonderful modality for
You know what
folks.
I'm going to ask you next?
I don't know.
What if you're ticklish?
Oh! Great question. So I'll usually ask people if they are, and start by just holding their foot. There's a
Getting them kind of used to it?
there's a warm up that happens. So this
Okay.
is one using part of your knuckle to press into the bottom of their foot. And certainly, if somebody's really ticklish and it doesn't work, it doesn't work.
Okay, yeah.
It's not going to work for them.
I had reflexology done, and I'm pretty sure it was you who did it. You must have been the one. I don't know, at the...
Oh, the healing garden.
Yeah.
Okay.
Way back when I was dealing with breast cancer.
Huh.
It must have been you, but somebody there did that for me. So, and it helped.
Oh, nice. It helped you relax, or it just helped?
Well, I remember being
anxiety?
very worried under a lot of stress and
Yeah.
just a lot of changes going on, and unknown stuff. So stress level was high, and I was seeking connection and seeking to just reduce my this sense of high alert.
Yeah.
Yeah.
Well, and that's one of the things that I think both reflexology and therapeutic touch offer is a sense of connection,
Yeah.
which is nice.
It's wonderful. Yeah. People, I mean, we're social animals. We need that. Yeah.
Exactly.
Yeah. So the third thing we talked about, integrative
Imagery.
Okay.
Yes. This is a method whereby somebody works with their own image to access their inner strength, to access their inner wisdom.
Oh, and before I forget, you're going to be on January 20th. You're going to be speaking with Confident Women Consortium on finding your inner strength. Is this going to tie into that?
Yes,
Oh, good.
definitely.
Good.
Yes.
All right. Yeah.
So I'll talk some about that, and then we'll have an opportunity to actually have the experience of accessing your inner strength.
Nice.
So the way it works is that I'll tell you what the process is. When I initially meet someone, I ask them what it is that they're looking to do. And in addition to accessing an inner strength and inner wisdom, some people come prior to surgery or after surgery accessing their inner healer. It can also help with pain. And there's a method for helping people ratchet down the pain with the use of imagery. It can also help people who are trying to decide if they're lucky enough in terms of a job search to have two jobs to decide which one they want to take. It's a way of helping them decide that. All of us have the wisdom within us, and the problem is because of the busyness of the outside world and because all these, the chatter in our brain, we don't often access it. And what I like about integrative imagery, it's a way of connecting to yourself. So the way it works is someone, as I said, comes in, I'll find out what it is that they're interested in working on. So I'm just going to give you an example of something that helped me when I was going through the training, which was accessing my inner strength. So I was having difficulty in a work situation and wanted to be able to maintain my sense of strength. And I will explain what that is, but I'll start with what the actual process is. So I clarify what somebody's looking for, then take them through a relaxation. Often a body scan, or somebody finds breathing helpful, help them get into a relaxed place. From there, they then, in their mind's eye, can access their favorite place. You know, maybe you like to be on a beach. Maybe you like to be in your backyard. Someplace that you're comfortable, so that the person is relaxed and then they're in a place of comfort. In the process of working with someone, they can be totally silent or they can dialogue with me. It's up to the person, and I've had both. So once you're in a relaxed state, what I ask the person to do is bring to mind an image that represents an inner strength, something like that. What happened for me is all of a sudden this Native American woman appeared. long dark hair, although she had a purple robe on, and her name was Raven. She just popped in my head. And that happens for a lot of people. Sometimes people see things in their mind. Some people just have a sense of something, but they don't know what it is. Mm-hmm. And the challenge is just to go with that, to be relaxed enough. What I do is ask a series of questions that the person can respond to verbally, or they can just be silent, and I'll keep with the questions. That lasts about 20 minutes. I'll then ask if the person, I ask a series of questions, and it allows them to dialogue with their image, which may sound strange. And again, for people who have experienced this, they find it incredibly powerful, because you're actually dialoguing with yourself. But you have...
I think it sounds very reasonable and helpful.
Yeah, you can have a visual image, or you might have a sound, or you might just have a sense of something.
It makes it very real, because there's the other piece that you're talking to.
Exactly.
Yeah.
And I'll just say that some people feel like it's a hypnotic session, but it's not.
Okay.
You just go very deeply.
Okay.
And before I start the series of questions, I'll ask if this image represents whatever it is, their inner healer, inner strength. If not, then we go back to being relaxed again and then allowing that to form. At the end, then we have time to process. But at first, I let people journal or draw or whatever they need to do to document the session. We talk about it, and then I ask them to find a time that week where they can get into a relaxed space, even just through taking some deep breaths, and access that image again. Because if you don't do that, you lose it.
Okay.
So it's a very powerful technique. Again, can be used for all the things that I just mentioned.
Do people have different images that they dialogue with, or do you hang on to that initial one that you conjure, or that appears? I don't know that you've actually purposely conjured it. It just sounds like it pops into your awareness.
It does.
Yeah.
Because you're relaxed.
Yeah.
And again, it may not be, some people can't image visually.
Yeah.
Some people have a sound.
Yeah.
I worked with somebody once who kept saying, "Oh, but I'm not getting anything, but I just have this sense." So I just had them go with that.
Yeah, yeah.
And they just stayed with this perception, which is very hard to explain. But they were able to have a sense of how they needed to move forward because of the dialogue we had. They were actually having a dialogue with themselves, but they were doing it in a relaxed setting with somebody who was supportive that allowed them to do that. Does that make sense?
Makes a lot of sense for me. As you know, I work with people with coaching, and often to do with, they'll come to me because of wanting to change their diet, maybe lose weight or change something, but it's such a bigger picture. And one of the hardest parts for me is to get them to believe, especially as they age and have had many failures or false starts or success and then rebound to gaining weight back, is getting them to believe that they can make that forever change. And that's where they need to go. They need to be able to change their story and realize they've written a story.
Exactly.
And this is a chance to kind of wipe the slate clean and start over.
Yeah, so it's paying attention to yourself, basically.
Yeah. So we have about 5 minutes left, and I want to use it wisely. So let's see. Anything that you can think of that you want to tell us about what you do to help people that we haven't covered so far?
Well, I think one of the things that's important about the work I do is that I take it's an overused term, but a holistic approach. So I don't just focus on these different modalities. Sometimes I'll see people who just need help with stress management, with sleep, so I'll use relaxation techniques with them, and then offer therapeutic touch or reflexology or imagery as a way of helping them relax. I make referrals. I do a lot of health education as a part of what I'm doing. So if I'm seeing somebody for therapeutic touch and they're having problems sleeping, I'll give them tips for sleeping.
Got it.
Same with reflexology or the imagery work.
So it makes it really helpful, as in my practice, that you have this strong medical background.
Exactly. It's the comprehensiveness that I think is so important in working with people, and not just focusing on these modalities. I mean, that's just a piece of the work. that I
see
do.
it. And we have a lot. We're different in how we approach it, but we do have a lot in common because of that. Because I think, and it's why I think we connected so well. Is we really have our that holistic, as you called it. You know, that we're really taking the whole person in. So
Yep.
I love that about you.
Thanks.
Yeah.
Well, and I just want to say, in terms of resources for understanding energy work, some people are familiar with Dr. Richard Gerber, Gerber,
Yeah.
who has written a couple of books on energy, and he explains it in a very simple way. So that would be one resource that I'd highly recommend. The other is a therapeutic touch practitioner by the name of Diane May, who's a colleague, does a lot of teaching. She's written 3 books. They're very down to earth. She's funny, and she explains things really well. And people can access that through Therapeutic Touch International, which is our international organization.
Very good. So, as I warned you about earlier, I wanted to ask you personally, what are the top 3 things you do to be totally well?
Okay. Well, what's on my mind currently is being present in the moment. And I think for all of us, it's helpful to just be present in the moment. I think that is so helpful to our health. And what I mean by that is just paying attention to the now. The other term, obviously, is mindfulness. Sleep is so important. I would like to get more than what I do. But I know I feel better if I sleep on a regular basis. And then for me personally, physical activity is so important. It helps emotionally, it helps physically, it helps with energy, it helps with sleep. So I guess just in thinking off the top of my head of 3 top areas, those are ones
Really
that come
critical.
to mind. Yeah. So meditation is a part of being present also, and I try to meditate on most days of the week. And I find it so incredibly helpful in being able to focus, in not reacting to situations, but responding to them, which so many of us don't do. And I would like to do a much better job of.
I just started an app called Waking Up, and it's teaching how to meditate. And that concept came into play where I didn't realize that meditation could be happening right now. Like we could, in a situation where you're maybe confronted or something, that you could sit back and apply it then.
Yeah.
So, so just before we wrap up, I want to make sure people know how to reach you.
Okay.
I wish we had more time to talk, but we're just about out. So one more time, it's Catherine Collins at Healing Ways and healingwaysconcord.com in Concord Center. Are you on social media? Or are there Facebook, Instagram, Twitter, any of those things?
I'm not on Twitter. I'm not on Instagram. Yes, I am on Facebook, and probably the best way is through my website that also has my phone number and my email address.
Very good.
Yeah.
Thank you for being a guest, and I look forward to the 20th of January when we get together for Finding Our Inner Strength at the Groton Inn, and thanks again for coming.
Thank you, Joyce. Thanks for the opportunity.